Hi, please find all the components in your Better Blood PRP Plus component kit with Bio Scaffolding. First, we are going to preheat our warmer. Turn the warmer on. Set the temperature to 75.5 degrees. Set the timer for 10 minutes. Press start. Next, we are going to prep our blood collection tubes. Pull each plunger down until you hear a click sound, then snap the plunger off as shown in the video. You will do this to all blood collection tubes. Please note, you are using 8 blood collection tubes for the blood draw for the first spin. The other 2 blood collection tubes in your kit are for the second spin. Now let's draw the patient's blood. We like to use a piece of medical tape to hold the butterfly needle in place. Please note how she is connecting the adapter on and off the blood collection tube. These blood collection tubes automatically fill on their own. Once full, you will see that the blood stops flowing in the tube. For reference, it stops filling at the top of the sticker on the blood collection tube. Be sure to fill each blood collection tube completely full or it will throw off the centrifuge. Once the tube is full of blood, disconnect and invert the tube back and forth to mix the heparin beads. You will invert the tube at least 3 to 4 times. Please note, if you are using a Dr. Kiss centrifuge, please remove the yellow tubes from the centrifuge. We will place our blood collection tubes in the centrifuge at 3,500 RPM for 8 minutes and press start. Once the centrifuge is done spinning, we will grab out the blood collection tubes and place in a working area. Be sure to always keep your blood collection tubes upright. You will grab your alcohol prep pads and wipe the tops of each blood collection tube. You will now grab your red cap in your kit to release the pressure from the blood collection tubes. See how she is taking each blood collection tube and placing it on the end of the red cap until she hears a click or feels the red cap break the seal. That's when she knows the blood collection tube has been depressurized. Please note, you are only going to use 7 out of the 8 blood collection tubes for the next step, leaving the last one for Bio Scaffolding. Now grab your 60 ml syringe in your kit with the transfer device attached. You will connect the blood collection tube and begin to draw out the platelet poor plasma into the syringe. You will stop drawing when you see the heparin beads get to the top of the green as shown in the video. Then place the blood collection tube back in the holder for when we need to use them again. You may need to release air from your 60 ml syringe as shown in the video. Once you are finished drawing off all 7 blood collection tubes, find your 6 ml syringe with the red cap in your kit. Attach the transfer device from your 60 ml to your 6 ml to pull the last blood collection tube for Bio Scaffolding. You may now dispose of your 60 ml syringe with the platelet poor plasma. You will be pulling approximately 1.5 to 2 ml of platelet poor plasma into your 6 ml syringe for Bio Scaffolding. When done, place your blood collection tube back in the holder. We will use this again for the next step. When done, locate your 30 ml syringe in your kit with the red cap. Place your transfer device from your 6 ml onto your 30 ml and red cap your 6 ml syringe. Place your Bio Scaffolding in the warmer for 10 minutes and press start. You will now go back through all 8 blood collection tubes, drawing off approximately 2 mLs of the Buffy coat from each blood collection tube into your 30 ml syringe. Once finished, dispose of all 8 blood collection tubes. Once you are finished, you will grab the 2 remaining blood collection tubes in your kit. Pull each plunger down until you hear a click sound, then snap the plunger off as shown in the video. You will now connect the blood collection tube to your 30 ml syringe with the transfer device. You will see that the plasma/blood will start to automatically fill the blood collection tube and stop when it's finished. You will then disconnect, invert the tube back and forth, and place upright in a working area. You will do the same thing to the second blood collection tube. Now take your 2 blood collection tubes and place them in the centrifuge at 1950 RPM for 8 minutes for our second spin. Dispose of your 30 ml syringe that has the transfer device connected. Once the centrifuge is done, pull the blood collection tubes from the centrifuge and place in a working area. You will now grab your red cap in your kit to release pressure from the blood collection tube. See how she is taking each blood collection tube and placing it on the end of the red cap until she hears a click or feels the red cap break the seal. That's when she knows the blood collection tube has been depressurized. Now grab your 20 ml syringe in your kit that has the transfer device connected. We are going to attach this to our blood collection tube. You are going to draw in your 20 ml syringe the platelet-rich plasma until the beads get to the bottom of the green on both tubes. Do not get blood in this one. You will end up with approximately 5 to 7 mLs of very strong platelet-rich plasma in your syringe. Locate the green filter. This will remove the white blood cells from the platelet-rich plasma. Also, locate your 20 ml syringe with the connector from your kit. Open your green filter and connect it to your 20 ml syringe. Now you connect your 20 ml syringe with your platelet-rich plasma to the green filter as shown in the video. Push your platelet-rich plasma through the filter through the other syringe. You will now disconnect the green filter as shown in the video that is attached to the 20 ml syringe. You will dispose of those items. You will now take your bio scaffolding and connect it to your 20 ml syringe with the connector as shown. Push the bio scaffolding through to your 20 ml syringe. Disconnect the 6 ml syringe and dispose. Locate the 20 ml syringe with the red cap in your kit and connect it as shown in the video. You will begin to mix the Bio Scaffolding and PRP back and forth approximately 15 to 20 times. You now have your final product. This process is used by Buckeye Physical Medicine and Rehab.